Hi, I'm so glad to be here, and I wanted to introduce myself. My name is Martha Piedra Santa, and I am the director of the Migrant Support Services Program, which actually is a very exciting brand new program that Lutheran Social Services in the National Capital Area is implementing. And we are working with local and federal partners to provide support services to individuals and migrant families that are seeking refuge here in the United States. While, as you all know, I'm sure that we have a long history of serving refugees and migrants, the Migrant Support Services Program really offers a unique opportunity for LSSNCA to provide mental health or trauma screening, as well as trauma-informed individual and family therapy. And we also are trying to promote access to general medical services that might be available in participants' communities. Well, I could say that the individuals that we are serving are working very hard to become sort of productive, kind of self-sufficient members of their communities here in the United States. And as I'm sure most of you can imagine, they have suffered much unthinkable trauma, let's say, in their countries of origin as well as in their journey here to the United States. So really the Migrant Support Services Program works with the program participants, and the majority of whom are from Central America and a few places in Africa, to really help them process, cope with, and overcome some of these traumas that they have been experiencing.
Hi, my name is Lisa Ford, and I'm the licensed social worker for Maryland, D.C., and Virginia area. And I'm the social worker who's the only social worker at this time who's been assigned to work with the migrant population in the Migrant Support Services Program. So I'm here to tell you a little bit about how the counseling services are going. And what I found is that a lot of times the involvement or the counseling sessions that I have with the clients is sometimes almost the first and only time that they've had a chance to talk to people about their traumatic experiences. It's also sometimes the first and only chance that they've been able to learn coping skills and ways to relax and deal with the trauma that they've experienced, the physical reactions or common reactions of the trauma that they've experienced. It's been a very exciting experience for me because I've realized that the work with the participants has been meaningful for me as well as it's been meaningful for the clients. Sometimes we've had tears, sometimes we've had laughter. As a social worker, I'm not only focused on their mental health and their mental health needs, I really try to be holistic and think about their social supports because I want them to be able to maintain themselves in the community or in the church with their family and friends, as well as their physical health. We found that some of the clients that we work with either have headaches, panic attacks, and so I really like them to see a primary care physician or go to a community clinic so we can get an assessment of their physical health.
With coronavirus, with COVID-19, we've had sort of an interesting silver lining with this program because we've been able to change and to transform all of our mental health services to virtual or telephonic services. And so I say it's a silver lining in a way because many of our clients would be very challenged trying to find transportation, childcare, other things to come to us. Now in the future, hopefully we'll have that will be a possibility. But we've really been able to reach, I believe, more people, fewer no-shows, as you might say, because you just need to be able to be in a private place and be able to answer your phone, and then you can do our counseling. So really, we've been able to work with it in this whole new environment that we're in. And also, we've been working very collaboratively. There are other partners that are implementing the same program. We, of course, are focused on the greater DC, Maryland, Virginia area. But we are partnering with Lutheran Family Services of Omaha, Nebraska, and also another organization called Chris 180 in Atlanta, both of whom also have extensive experience in mental health and counseling. And so we sort of learn from each other. We're covering other geographic areas, and I think we've all been able to implement the program in a more rich way by having each other to share ideas with it.